without further ado, it is my absolute pleasure. I love awards. I've served on the alumni committee for several years now, and this is probably one of my favorite things because of just the rich heritage that we have at Vanderbilt and the gift of sharing in these achievements. So the first award I would like to present is the Alumni Award for Clinical Achievement in Nursing. And this is presented to a VUSN or PhD in Nursing Science graduate for outstanding contributions in clinical patient-centered practice. This year's recipient is Heather Quayle, MSN 2001. When asked by Marty Kemp, wife of the Georgia Governor Brian Kemp, to create, implement, and lead the medical program for Human Trafficking Center for Teenagers, Dr. Quayle rose to the task. Wellspring Living is the first of its kind in the state of Georgia, and Dr. Quayle implemented its medical intake system. She now leads its multidisciplinary team to support comprehensive, holistic care and placement for each participant. When necessary, she provides sexual assault nurse examiner assessments for patients and appears in court as an expert witness to testify on behalf of the program members. In addition to that work, Dr. Quayle is founder, owner, and clinical director of the Sexual Health Optimization and Wellness, also known as SHOW Center, outside of Atlanta. She conceived of the facility to provide a safe, non-judgmental place for patients with sexuality concerns looking to achieve optimal wellness. This includes offering services for sexual health, menopause, sex after birth, and sexual trauma. Dr. Quayle is on the board of the National Association of Nurse Practitioners in Women's Health and adjunct faculty at Georgia State and Vanderbilt. We are grateful that she precepts many of our students. Throughout all of her work, Dr. Quayle is published and gives lectures, and she is involved in legislation and lobbying at the Georgia Capitol on issues affecting advanced practice nurses, rural health care, human trafficking, and women's health. She received her DNP at Chatham University in Pittsburgh. Congratulations, Dr. Quayle.
Thank you so much. Dr. Norman, fellow honorees and colleagues and friends, thank you so very much for taking the time out of your day to be with us for this unprecedented virtual awards ceremony. I'm truly honored to be receiving the award for VUSN Alumni Clinician of the Year for 2020. The fact that this award is presented to me by Dr. Norman during her tenure as Dean of Vanderbilt University is also an added honor. She was actually the Assistant Dean during my time at Vandy and has left an indelible mark on the School of Nursing. It is also very special for me to note that exactly 20 years ago, as I stood in the VUSN as a nurse practitioner student, I was pregnant with my first son, who's also now a freshman at Vanderbilt in the undergraduate class of 2024. Wow, does time fly. During my career, I've had the opportunity to work for and collaborate with some of the best medical providers in the country. I've been able to meet, care for, and engage with some of the best patients who've made me into the provider I am today. I'd like to thank all of my colleagues and patients collectively for their productive interactions and prolific exchange of ideas and the challenges that have been presented to me over the years. Receiving an award like this makes me reflect upon the past and all the things that have shaped me into who I am today. When I examine the achievements of nursing over the past 20 years or so, I realize there is a lot of that our profession should be very proud of, and a lot of work that we still have left to do. Awards like this are a reminder for us to keep putting in the hard work and to constantly pursue learning and growing as providers. Today, I want to focus on what I like to call my hardest but yet most rewarding job in my 19 years as a women's health nurse practitioner. I've been heavily involved from day one in what I like to call my passion project: creating, planning, implementing, and caring for teenagers 12 to 17 in the state of Georgia who are victims of human trafficking. This has been an initiative of the First Lady of Georgia, Marty Kemp, and I was asked to create the medical framework for a residential facility attached to the nonprofit Wellspring Living. We are a 20-bed facility in the state of Georgia, offering medical, education, and mental health services to trafficked youth. This year, we received IRB approval, and my goal for the next year is to disseminate and publish our data and be a model of care for other centers across the country. Trafficking is a huge public health crisis, and unfortunately, it's happening in our backyards. It is sadly a $150 billion industry. The hardest and yet most powerful quote to hear, but sums up what this looks like, is you can sell a kilo of Coke one time, but a trafficked girl can be sold multiple times a night, 365 days a year. I don't want to end on this note, so I would like to close by acknowledging my husband, Stephen, who has been with me for the past 29 years, my better half, created a beautiful family with me, and we are blessed with 3 wonderful sons, Chandler, Cody, and Chase, who are definitely my life's greatest accomplishments. Thank you so very much. I'm truly humbled and honored.
Thank you very much for sharing that with us. The Alma Galt Alumni Award for Public Service memorializes VUSN's 4th Dean and honors dedication to localized public service and/or allegiance to working with underserved communities by a VUSN or PhD in nursing science graduate. This year's recipient is Michelle Ruslavage, MSN 10, DNP 13. Early in her career as a certified diabetes educator at Claremore Indian Hospital in Oklahoma, Dr. Ruslavage provided comprehensive diabetes education and care to over 4,000 Native American patients. Hers was one of the first sites in the Oklahoma area to participate in the diabetes audit, a national aggregate of clinical outcomes which led to the improvement of patient tracking and standards of diabetes care. Working at United South and Eastern Tribes, Inc., an intertribal organization, Dr. Ruslavage managed a $2.5 million grant leading to the implementation of a national certified electronic health record in 9 Indian Health Service areas. Her work improved workflow efficiency, increased productivity, provided comprehensive immunization record, and decreased over and under immunization in patients. She developed the curriculum for Indian Health Service Public Health Nursing Informatics training, funded by the American Recovery and Investment Act of 2009, and then implemented this program at 10 sites. Dr. Ruslavage has been deployed by Indian Health Service to assist tribes affected by California wildfires and provided emergency health services to over 100,000 athletes and spectators at the North American Indigenous Games in Denver. She has recently taken on a new role with the Centers for Disease Control and was stationed at Boston Logan International Airport in the early days of COVID-19 to lead the team that conducted screening of all arriving international passengers. She is on the faculty at VUSN, preparing the next generation of informatics nurses in a time when they are becoming increasingly needed. Congratulations, Dr. Ruslavage.
Oh, well, thank you, everyone. And I really want to first off acknowledge everyone involved with the planning and selection of this. I know this is unprecedented, and I realize the amount of time it took with planning something like this to have a virtual awards ceremony. So thank you very much. And especially being in informatics and behind the scenes, I know and really can appreciate the time and effort of getting ready for something like this and the technology that may or may not kick off like the way we'd like it to do. So thank you to everyone on the planning committee and the alumni board. I appreciate that. So, and I also want to, like my colleague Heather just spoke about, having been notified as being the recipient of this award really caused me to pause and reflect on my professional nursing career over the time since I started it. And I started out as a nursing scholarship recipient for every year I was on the scholarship, I provided a 2-year payback service for that. So I really started out with a 4-year payback, which has now turned into 23 years of public service. And you look back and it's that infamous question, where did the time go? And I look back and I've had the highest of highs and the lowest of lows in my nursing profession. And it's always the highest of highs from my patients and colleagues that really stand out and make me look forward to the next day and what else is out there that I can contribute to the nursing profession, our public communities, our patients, to make lives better for our society as a whole. And working with the Native American population, there's over 570 federally recognized tribes throughout our country in the United States. And each one of them, while there are some commonalities that go through 579 plus federally recognized tribes, there are very distinct traditions and cultures that they have that are unique to each tribe. I have not interacted with all 570, but I have interacted and done some work with a good majority of them, going from Maine down to Florida and as far west as Texas. But as a regional nurse consultant, that role also took me out west a lot, working with the Navajo Nation and our Alaska community up there, where you would have to take a shuttle, a puddle jumper to get from community to community. You also had to be alert of the cold weather conditions that occurred up there. So it has been a very fulfilling experience in my profession. And also looking at being a public health commissioned officer and the opportunities afforded to me to act in a public health capacity, whether it's, as mentioned, being deployed out to the California wildfires, Boston Logan Airport for COVID screenings, and anything else they may need me at. Right now, I'm currently in deployment status at the CDC for the immunization activities and the state registries that are going on. So I just never know what the next corner is going to provide. But one thing I do know is preparing our next generation of nurses and looking for those opportunities to reach out to our younger generation and preparing those nurses and mentoring them so that they're ready to carry on the torch for our nursing profession. So thank you very much for this award. I appreciate it.
Congratulations and thank you as well. Our next award is the Alumni Award for Diversity Inclusion, and this is presented to a VUSN or PhD in nursing science graduate for notable work toward reducing social barriers that silo people and to create awareness of bias in order to generate more inclusive yet diverse organizations in nursing. This is a new award this year, and its premier recipient is Rume Alexander, who got her MSN in 1977. Dr. Alexander is a person of many firsts. She has spent the greater part of her career helping others to be conscious of how each person's circumstances and experiences affect who they have grown to become. At the University of North Carolina, Chapel Hill, the oldest public university in the country, where she started as the director of the Office of Multicultural Affairs at the School of Nursing, and recently served as an associate vice chancellor and chief diversity officer for the entire university, Dr. Alexander has coached faculty, staff, and students to be open to views other than their own. Her enthusiasm is for equity of opportunity and for holding courageous dialogues to steward and promote human flourishing. On this topic, Dr. Alexander has written multiple articles and book chapters. She served on numerous commissions and initiatives as well. She is a speaker, a teacher, and a mentor. Her work is utilized by many varied organizations striving to foster equity and inclusion of people from multiple backgrounds. Dr. Alexander served as president of the oldest nursing organization in the U.S., the National League of Nursing. She received the American Organization of Nurse Executives PRISM Award for Workforce Diversity Leadership and the Southern Regional Education Board's M. Elizabeth Carnegie Award. In 2019, Dr. Alexander served as a consultant to VUSN, where she spoke to faculty, staff, and students about inclusive excellence. Currently, Dr. Alexander holds several positions at UNC Chapel Hill: professor in the School of Nursing, special assistant to the dean of the Adams School of Dentistry, and former associate vice chancellor for diversity inclusion and chief diversity officer. She holds a Doctor of Education in Administration and Supervision from the Tennessee State University in Nashville. Congratulations, Dr. Alexander.
Thank you. Thank you very, very, very much. When I heard that I was going to be the premier recipient, I immediately thought of the Academy Awards, and I said I was going to start this thank you with, I'd like to thank the Academy. And so I've been waiting and waiting for that opportunity to do that, and you provided that for me. So thank you for that. And thank you for this award. The work I've done is arduous, and it's long standing. But I must say that the Vanderbilt experience prepared me very well for what I would be facing in the future. There was not a DEI council when I was a student. There were not a lot of us who were like me in the programs. And yet I found my place there. I was cared and nurtured. I was mentored and educated quite well, so well that I have found myself in many places as the first or the one to pioneer new programming. When you're in those spaces, you don't have a roadmap. So one of the things that this Vanderbilt education provided for me is how to be innovative and creative, to think out of the box, and to be confident about that which was a difficult subject for a lot of people, and allowed me to navigate them into spaces that I think probably they didn't even entertain in their own minds that they would be about. So I consider this a great honor, and I think the work is great. Human flourishing is what I'm all about. And I like to say that Vanderbilt taught me not only, well, let me change that. Vanderbilt not only invited me to the dance, it allowed me to dance, and it even allowed me to lead some of the dances. So I think that's about the best thing ever. And I can dance on the foundation that I have been given. You've heard about many of the spaces and places that I've been a part of, and I've known many of you for a good while. I've known Linda for a long time. And even when I worked at the Hospital Association there in Nashville. So, and I am grateful to so many of you. I see Mavis, and I'm happy to see her, and I see Rolanda, and I'm just, Camille, Tamika, all have been a part of some of the sessions where we just really hashed out some difficult conversations and allowed ourselves to be authentic in the space, to trust each other, to hold each other with dignity, but also with accountability. And that's the work itself. Finally, I want to say to you, I think stories are very, very important. And I had no idea at the time that something I was living through would become a story for me later that involved Vanderbilt. But it actually was that I was invited on an interview. And the individuals who invited me thought I was French or Italian until I showed up, because my name did not give away that I'm African American. So the rest of the dance of that interview, if you will, was to figure out how to keep me from taking the position, that it was never intended for me to be a part of the interview process. So the dance began, and there were lots of questions brought my way. But the one that really framed itself around Vanderbilt was this idea of asking me to speak extemporaneously and also to show evidence of my writing. And I had graduated from Vanderbilt probably about 3 years prior to this position. The whole time I'm screaming in my head, I am a Vanderbilt graduate. What do you mean? I would have never graduated. Could I not write? Could I not keep my verb and my noun in the same tense? and not be knowledgeable and competent in what I had to do. And so rather than saying that out loud, I just demonstrated that. And I owe it to the great foundation that I got at Vanderbilt. So I'm extremely grateful and honored to be your premier honoree for this award. I continue to spread across the nation and internationally that Vanderbilt grads make a difference. And when I saw the tagline that you had, it reminded me of the tagline I created for UNC Chapel Hill. You know, there's several blues in Chapel Hill, and they could be, Julie knows this well. They like to say UNC Chapel Hill's blue is heavenly blue. But the bottom line is an inclusive blue begins with you. And when I saw your tagline, it was very close to that same sentiment. And so I've been happy to work with all of you, steward with you as an alum, but most of all, I am very appreciative for your acknowledgement of what has been good work and good trouble, which I stay in all the time. Thank you.
Congratulations and thank you very much. I would like to turn this over now to Dr. Ty Williams. His degrees are an MSN in 2003 from Vanderbilt, a DNP in 2012, and he currently serves as an assistant professor, and he's a founding member of the VUSN Alumni Board and resides in Los Angeles. Thank you, Dr. Williams.
Thank you for asking me to present these next 3 awards. The first award is the Catherine Hanley Class of 1912 Rising Star Alumni Award. It is named for the school's first graduate and is conferred to a VUSN or PhD in Nursing Science graduate who is within 7 years of being pinned, shows outstanding promise in healthcare, and brings honor to the Vanderbilt degree. This year's recipient is Jessica Walker, MSN 2015, DNP 2017. Jessica graduated with her MSN and received the VUSN Founders Medal. She began working at the Homeless Psychiatry Consultation Liaison Service in the Vanderbilt Department of Psychiatry and Behavioral Services while a student in our DNP program. In January 2020, she was named team lead for advanced practice providers at Vanderbilt Psychiatric Hospital, where she was the very first psychiatric nurse practitioner to be promoted from the nurse practitioner track to clinical assistant professor. Jessica is a leader within multiple organizations and is chair of the American Psychiatric Nurses Association Practice Council, secretary for Sigma Theta Tau's Iota chapter, president of Vanderbilt's chapter of the National Alliance on Mental Illness, and co-chair for VUMC's Advanced Practice Professional Development Committee. Jessica's nominator commented, "To say that Jessica is a rising star and has outstanding promise in healthcare is a marked understatement. She is not only the best colleague with whom I've ever worked and supervised, but she is the most clinically attuned, socially conscious, patient-centered advocate that Vanderbilt, as a whole, has likely ever had or will have for many years. She has been at the center of many ethically complex cases over the last several years. Where others may have stepped away, she will step in. I have watched as she has quietly gained the respect of students, nurses, residents, physicians, and the community. Given this award honors someone with outstanding promise in healthcare, I can think of no better person to represent the School of Nursing in this area. On a personal note, I first had the pleasure of working with Jessica when she was a student in the DNP program, and now I get to teach with her. Congratulations, Dr. Jessica Walker."
Thank you. I'm truly honored to receive this award and love that it's named after the school's first graduate. I knew that I wanted to graduate from VUSN and become a nurse since I was young. I was inspired by all the talented VUSN alumni that were around me in the community and answered my questions and allowed me to shadow and meet with them, even as a high school student. A big thank you to VUSN faculty member Jenny Kim for meeting with me during this time. I also first started coming to the VUSN open house days when I was in high school and enjoyed learning about all of the different nurse practitioner specialties. Although I changed desired specialties over the years, I never changed my dream of wanting to become a VUSN nurse practitioner. After doing my BSN clinical rotations, I knew that I wanted to go into psychiatry. My dream of becoming a VUSN student came true in 2012 when I started the PMHNP program, and it was even better than I imagined. I enjoyed being a VUSN student so much that I seamlessly transitioned into the DNP program after learning about the degree and realizing that combining the DNP with my MSN was the perfect fit for me and my career aspirations. My education and experience as a VUSN student were invaluable, and I will always be forever grateful. Not only did VUSN prepare me for my future career, it also supported me every step of the way as I continued to work as an inpatient nurse and nurse educator, and subsequently as a nurse practitioner. VUSN has never stopped supporting and mentoring me from my first day as a student to this day, and helping me grow in teaching, scholarship, and service activities. I enjoyed the first 4.5 years of my employment postgraduate school providing psychiatric consultations for patients experiencing homelessness admitted to the medical hospital, and later becoming a team lead for PMHNPs. I'm also incredibly grateful for my Vanderbilt University Medical Center experience and their tremendous support from my time as a nurse extern to a registered nurse and then an advanced practice registered nurse. I'm thrilled to be currently working at VUSN in the PMHNP and DNP programs, as this role allows me to teach students about my passions. I've also developed another passion, and that is doing contact tracing for COVID-19 and getting to be a part of this new amazing VUSN contact tracing team. I started part-time a few years ago and am so fortunate to now be a full-time member of the VUSN family. I cannot thank all of the VUSN faculty and staff enough for everything they have done and continue to do for me. I'm truly blessed to have been a VUSN student twice and now a faculty member. I appreciate this award and also want to recognize that I would not be where I am now without VUSN and also my wonderful VMC colleagues, undergraduate experience, supervising physician Cheryl Fleisch, and family. Thank you all, and also to Catherine Hanley for setting the precedent as the first VUSN alumna.
Thank you, Jessica. Congratulations again. Okay. The Friend of Nursing Award recognizes significant local, national contributions, or both, to the profession of nursing from an individual who is not a nurse or a Vanderbilt nursing graduate. This year's recipient is Rachel Lane Walden. Rachel is a reference librarian at Vanderbilt's Eskind Biomedical Library and serves as the library liaison to VUSN. In that role, she collaborates with faculty and students of all nursing specialties and degree levels to explore phenomena of interest and develop high-quality sound search strategies. She has a broad reputation for being especially responsive, informed, and dedicated. Karen Handy, DNP 14, and I nominated Rachel and cannot sing her praises loudly enough. I'm sure the other faculty members and alumni on this call who have worked with Rachel would agree. Students in our DNP program consistently report that Rachel is an invaluable resource. Students and faculty rely on her expertise, skills, and impressive knowledge base to guide inquiries and literature searches to help us find the evidence we need. Rachel goes above and beyond her professional responsibilities to support student success. Students and faculty have repeatedly noted that Rachel has a keen understanding of nursing students' scholarly work and facilitates their learning in a way that complements their learning styles and coursework. Rachel Walden is truly a friend of nursing. Congratulations, Rachel.
Thank you so much. I was beyond surprised and shocked when I was told that I was receiving this award. And thank you all so very much. So I was very lucky back in 2015 when I first started here at Vanderbilt to slowly kind of fill in for some of the other librarians over doing presentations at the School of Nursing. And then finally I was kind of, thrown into the liaison position, and I definitely, ran with it. And it has been an absolute delight to work with everyone, faculty, staff, and students. And I'm always just amazed at the research that the students are working on, the projects they're trying to implement in their communities, and then of course all of the amazing research that the faculty is working on. And it's just really, it's been amazing being able to work with everyone. And I didn't really prepare much to say because I do better on the fly, so I don't have anything fancy to say. Also, as we can tell, during this pandemic, I keep changing my hair a lot. So we're on, I think, my third color for the last 6 months. But yeah, and again, thank you so much for this honor. It's just very, very nice to be appreciated and hear nice comments. And my mom is a nurse, and she was very, very proud that I have been received this honor. So thank you so much.
Well, it's wonderful working with you, Rachel. Okay, next. The Alumni Award for National Leadership is given to a VUSN or PhD in nursing science graduate who affects a broad impact on healthcare, typically on a well-recognized national or global level. This year's recipient is Katie Lands, DNP 2010. Dr. Lands is a member of Vanderbilt's inaugural DNP cohort. In 2014, she partnered with Senator Bill Frist to found Aspire Health, where she served as Chief Clinical Officer. Under her leadership, Aspire trained over 800 advanced practice providers, physicians, nurses, and social workers across the country, growing to be the largest palliative care practice in the US. Katie coached countless nursing leaders, each building their own army of community palliative care providers. In a short time, the Aspire model was adopted by the Centers for Medicare and Medicaid Services, transforming reimbursement and policy norms. As founder and CEO of Topsite LLC, Katie educates healthcare partners to build models of community-based support for aging populations. Confronting the COVID-19 pandemic, she has designed training for providers on having difficult conversations, including life or death decisions about patient care. Among her many leadership positions, Katie is currently director of the board of the National Hospice and Palliative Care Organization and has been in significant roles within the Hospice and Palliative Nurses Association, the Center to Advance Palliative Care, and the National Coalition for Quality Care. She is also a contributor and author of the Oxford Textbook of Palliative Nursing. Her nominator stated that Katie's disruptive innovation, compassion, and gritty entrepreneurial leadership have touched hundreds of thousands of providers and patients across America and led to major value-based policy changes that continue to support Medicare beneficiaries and families suffering from serious illness today. Congratulations, Dr. Katie Lands.
Hi. You guys, this is fantastic. I didn't really prepare much either, but I just got to tell you how grateful I am to be amongst such a great group of people. It's a lot of fun to be here with you tonight. And you can see my friend Patty from our inaugural, it's 10 years, 2010, that we were the inaugural DNP cohort. I noticed that Donna MacArthur is on here too, who was a huge inspiration to all of us, as she said, to be disruptive innovators. And that we have done, Donna. And Linda, you were there too when this all went down. And I just want to say, you know, just amazing thanks for the opportunity to be here and receive the National Leadership Award. I did not bring my plaque. I'm actually doing work in Nashville this week and asked Patty to come over. She was my roommate when we would stay at the Embassy Suites and celebrate this with me. And I want to thank my nominee. I see that Missy Wilmerth is on there too. Missy Wilmerth was in our inaugural class and nominated me for this award. Thank you, Missy. I love you and your stilettos, the patent leather stilettos that drew me to you in the very first place in that first day of school. So, you know, you guys, I know I'm being silly, but in all seriousness, I am here because I have chased my passion. And from the very first day that I was a nurse in the ER, before I went in 20 years ago to serious illness care for hospice and palliative patients, it was because I was coding patients time and time again from my own community in High Point, Greensboro, North Carolina. And I just want to say that it feels horrible when patients and families don't get the choices about how their end of life could and should be. And I'm just so thankful to have had all of the opportunities that the School of Nursing gave me from Vanderbilt. The systems thinking in the DNP program, the economics on how to build a business plan, as much as we hated it, and present that to people like Chris and help economize a model of care that scaled to hundreds of thousands of patients across America. I can't even begin to say all of the things that network, the environment gave me, the friendships and the opportunities that followed are countless. But I also want to say that it comes from a foundation that my family, who is on the call right now, my mommy and daddy, Phil and Nancy, and my sister Leslie gave me. And that is a huge thanks to you for showing me grit, resilience, using your heart and your compassion and staying true to who you are. And I love you for that, Mommy, Daddy, Leslie. So I could tell you lots of stories about what I've done and all the little titles and things like that. It really doesn't matter. I think what matters is that if I have this little platform for what it is, you know, and it's just shake things up, you know, just don't hesitate to say, tell me more about what you're up to, how you're doing it, and call anybody that'll listen. The people who make the big decisions, show up and be there. And my favorite, I am from the South, but I do live in Pittsburgh these days because my heart took me there. And my husband, if he were on this call, I would say, thank you for giving me the opportunity to dream huge and just follow my passion and take huge risks, because I have done that. And they are scary. And sometimes not sometimes, always without him and my family and my colleagues to not tell me I'm crazy, which I am crazy a little bit. It's just everything. And just keep asking questions and following your dreams. So Dolly Parton says, find out who you are, your legacy, and do it on purpose. Okay, so I'll leave you with Dolly, and lots of love in my heart. And thanks to the School of Nursing for just loving on me for this award and loving on me in my education and providing this great infrastructure and foundation to go kick some ass. Okay, love you.
Thank you, Dr. Lands. I think the theme that keeps recurring is just a lot of innovation and disruption and not being afraid to go against the status quo. And that's so inspiring on so many levels. And I love that that's been shared. The next award is the Alumni Award for Innovation in Healthcare. And this is presented to a VUSN or PhD in nursing science graduate who uses nursing experience and knowledge to create tools that solve healthcare issues. This year's recipient is Melissa Geist, MSN 96 and EDD 04. Dr. Geist is a full professor in the VUSN Hester School of Nursing at Tennessee Tech and a practicing family and pediatric nurse practitioner in Cookeville, Tennessee. As a founding member of the Renaissance Foundry Research Group, a team of interdisciplinary scholars dedicated to advancing innovation-driven learning, Dr. Geist designs courses and opportunities for students to create tools that solve healthcare problems. Many of these projects combine the nursing curricula with those of engineering, computer science, professional studies, and education so that students from multiple disciplines collaborate to create prototypes of innovative technology that address a healthcare-specific challenge. Dr. Geist has published on innovations in nursing education, interdisciplinary education opportunities, and the connections between research and application. She has received many accolades for promoting collaborative innovation in healthcare, such as the Mandala Award for Global Humanitarian Service, the Annie Floyd Cosi Award for Excellence in Research, the Tennessee Tech Outstanding Faculty Award for Teaching, and the VUSN Hester School of Nursing Outstanding Professor Award, which she has received multiple times. In addition to her MSN and Doctorate of Education from Vanderbilt, Dr. Geist holds post-secondary degrees in biomedical engineering and chemical engineering. Her nominators say, "We are very privileged to have Dr. Geist as such an amazing colleague and collaborator, and we are extremely proud of her and for this and all of her wonderful achievements and contributions to the intersection of the fields of nursing, engineering, and education. Congratulations, Dr. Geist.
Thank you so much. I love coming on the heels of Katie and talking about disruption and innovation because that's pretty much what I am talking about. But I do want to thank the awards committee for selecting me for this honor and to say kudos to Vanderbilt University School of Nursing for recognizing nurse innovators and entrepreneurs. And from what we've heard today, that's part of the fabric of Vanderbilt University School of Nursing. Just like it took some people in the early 1990s to catch on to the idea of a bridge program, a program that embraces and celebrates bringing diverse professional backgrounds into nursing. Convincing others that nursing and engineering students could and should attend clinical together to solve complex healthcare problems was a challenging prospect. But for 6 years, this is what I have done, along with my brilliant engineering colleagues, in the Clinical Immersion at Disciplinary Interfaces course taught at Tennessee Tech. The course we launched empowers nursing students to see themselves as change makers and disruptors of the status quo. Our teams of nursing and engineering students have developed devices that address everything from spaghetti syndrome, the tangle of cords and IV tubing found in intensive care units, to a glove that helps senior citizens maintain their grip strength. Our teams have won or placed in numerous design competitions in the local, state, and national level. Some have gone on to open businesses. But these successes are secondary to the impact we have on current and future nurses who develop creative and entrepreneurial habits of mind rarely fostered in nursing. Whether working with environmental engineering students and faculty to develop and build the first composting latrines in a remote Mayan village, or partnering with engineers from the premier engineering university in Havana, Cuba, to improve the lives of senior citizens through human-centered design, our nursing and engineering teams repeatedly demonstrate the power of integrating disciplines to solve wicked health-related challenges. To this day, I get pushback from some in the nursing community. A recent editor stated that a manuscript that connected design thinking to the next generation clinical judgment model was not interesting to nursing faculty. Thankfully, this attitude is becoming obsolete. The American Nurses Association, the Society of Nurse Scientists, Innovators, Entrepreneurs, and Leaders, or SONCIEL, companies like Johnson & Johnson, and academic institutions like Vanderbilt University and the Whitson Hester School of Nursing recognize that nurses must be in the room where healthcare innovation happens. So once again, I'd like to thank the Vanderbilt University School of Nursing for providing the perfect launch pad for an incredible career, and for this award recognizing the accomplishments of my students and the entire clinical immersion team. Thank you very much.
Thank you, and again, congratulations. The Lulu Wolf Hassan Plug Alumni Award for Distinguished Career in Nursing is named for the former VUSN faculty member and distinguished nursing advocate, and this is presented to a VUSN or PhD in nursing science graduate whose professional leadership in the nursing field reflects a history of achievement within the discipline. This year's recipient is Kwei-Ru Chu, PhD 1997. Dr. Chu bears the distinction of being Vanderbilt University's very first recipient of the PhD in nursing science. She currently serves as Dean and Distinguished Professor at the Taipei Medical University College of Nursing. Her interest in mental health, geriatrics, and nursing education have propelled her to prominence throughout Asia and internationally as both a scholar and a leader of nursing pedagogy. As a passionate leader in the development of advanced practice nursing and doctoral education in Taiwan, Dr. Chu's teaching and mentoring abilities have been recognized with multiple awards, including the Outstanding Professional Nurse Award from the Taiwan Union of Nurses Association. She has participated in multiple committees and consultations managed by various ministries of the Taiwanese government. She was executive director of the Taiwan Nurses Association and has served among the leadership of the Lambda Beta at large chapter of Sigma Theta Tau in Taiwan. She was recently honored to be elected as a fellow in the American Academy of Nursing. Having published over 100 scholarly articles, Dr. Chu has served on the editorial boards of both the Scientific World Journal and the Journal of Nursing Research, where she received the top author award in 2011. Her body of research is so prolific that in 2018, she was inducted into the International Nurse Researcher Hall of Fame by Sigma Theta Tau. Congratulations, Dr. Chu.
Thank you. Thank you so much. It is with great emotion that I received the 2020 Lulu Wolf Hassenplug Alumni Award for Distinguished Career in Nursing. I cannot express how honored and humble I am to accept this award. I want to thank the Alumni Association and the College of Nursing, Vanderbilt University for this award. I would like to take this opportunity to thank everyone has made such a huge impact on my life. First, I would particularly like to thank Dean Linda Norman. You were there 26 years ago. You has been such an inspiration for me to look up to. Your years of dedication to furthering Vanderbilt nursing and advancing nursing scholarship is one that I deeply admire. I would also especially like to thank my mentor, advisor, Bonnie Holliday, for your enormous encouragement and support. Your tireless efforts to helping with meeting challenges have inspired me as the first and also to do likewise for others. My advisor, Linda Lemerton, Director Catherine May, and Professor Ken Watson, all of the faculties, you are so supportive of me as the first graduate 26 years ago. I still keep the Vanderbilt registered report for these years. And from these mentors and advisors, I have learned so much from all of you about perspectives on academia, research, and the attitude toward life. I would also like to recognize and thank my fellow classmates, Rolanda Johnson, Sharon Dowdy, I know you are here today, Sharon Saylor, and Donna Blackburn. You all help me with love and encouragement. All of you provide an abundance of intellectual and support. You assisted my transition to life in a foreign country and provided much needed resources that still warms my heart to this day. My family, of course, deserve much recognition, especially my husband. Thanks for your endless support across everything I have done and continue to do. I'm also very grateful to Taiwan's National Defense Medical Center and Taipei Medical University for cultivating my talents and providing so many opportunities for me during my career journey. There is an Asian proverb that says, it takes 10 years to cultivate wood from the tree, and it takes 100 years to cultivate talent from a person. I believe Vanderbilt education is a lofty undertaking. During the cultivation journey, I will continue to move forward, uphold the visions and values that Vanderbilt has helped to instill in me. Each journey starts with a small step. Vanderbilt has given me the ability and skills to help oneself and others face setbacks and challenges, and most importantly, continue to make contributions to the nursing profession and to the global society as a whole. Thank you very much.
Thank you, and again, congratulations. Our final award this evening is given to the honorary alumni or alumnus, and it's awarded in recognition of significant contributions to the School of Nursing by an individual whose academic credentials were obtained elsewhere. This year's recipient is Robin Stephen. Robin has been a stalwart supporter of VUSN for many years. As Chief Nursing Officer of the Vanderbilt Adult Hospital, she is well known for her leadership over multiple committees and groups that place nurses and nurse practitioners in roles that improve patient care and drive operational change across a multitude of clinical areas. After receiving her MSN from Wayne State University in Detroit, Robin was a staff nurse and clinical nurse specialist at hospitals in Michigan, New York, and Rhode Island. She came to Vanderbilt University Medical Center in 1990 to serve as the nurse coordinator for the 7 North Cardiology Unit, where she stood out as a leader among her peers. In time, she became Chief Nursing Officer and Chief Administrative Officer at the Vanderbilt Heart and Vascular Institute. In 2014, Robin was promoted to the newly created position of Chief Nursing Officer for Vanderbilt University Hospital and Clinics. In an interview, VUMC Executive Chief Nursing Officer Marilyn Debris marveled that Robin has been a transformational leader for nursing and patient care at Vanderbilt since her arrival. She has published and interviewed for multiple topics such as patient safety, nurse leadership, and breaking down barriers to care. Congratulations, Robin.
Well, thank you so much. It is just a pleasure to be with you and so humbling to be amongst all of you who are so very accomplished. I want to thank you all, and particularly the committee who are convening this award on me. And especially I want to thank Marilyn Debris and Linda Norman, who have been so committed to fostering an incredibly strong and strategic partnership between VUMC and the School of Nursing. It's that partnership that has given me proximities to so many of you on this call tonight, and who have strengthened me as a nurse and as a privileged leader of the nursing profession. You know, this award is supposed to recognize and honor someone who's been loyal and served and supported the university. And I'm so humbled because I think the absolute reverse is true. You have been incredible partners in advancing our mutual interest in research, practice, and education. And the fingerprints of the School of Nursing are everywhere in the medical center, and we see that every day. On the research side, through efforts by Nancy Wells and Ruth Kleinpel and so many other people, nursing research has become a reality here at VUMC. You've inspired us, you've guided us, you've written for us, you have done statistics for us, and you have made this a practice environment where we can ask questions and we can find the answers that will forever change the practice of nursing. You have been a wonderful source of education for our nurses. In the presence of Vanderbilt School of Nursing students, you have sharpened us. The hunger of the students has made our staff want to teach and to show them not only what they do, but why they do it. The School of Nursing is in fact the reason that many people come to be employed here at VUMC, and that is because they want to be VUSN students. So they come to us and then they enter the school. So thank you for that educational mission. And lastly, in practice, we reap the benefits of those who have crossed over your threshold with a degree in their hand. You are the source of so many nurse practitioners, nursing leaders, informaticians who shape us every day. They serve our patients, they lead improvement and informatics, they organize teams. They're leaders of literally thousands of nurses who care for patients. They collaborate with other disciplines, they design care, they balance budgets and resources, they establish practice standards, and they do all of that because you taught them how. So I thank you for this honor, and I know how true it is that even though I've never earned my degree from you, I have been very shaped by you and through that incredible partnership. And I'll always remember and never forget the responsibility I have and the commitment I have to strengthen the Vanderbilt School of Nursing and foster that mutually beneficial partnership so that we can together elevate education, research, and practice. I thank you so much.
Thank you. And now I would like to offer a toast in celebration of our award winners. Your dedication, innovation, disruption, and commitment to nursing and to community and to Nashville and all kinds of other places across the world have not gone unnoticed. Vanderbilt has a rich history of trailblazers that have laid a foundation for where we are today, and we are so thankful that you are a part of that. We applaud and appreciate you. So raise your glass if you have one, and I salute you. Thank you.